The Recovery and Stay Well Plan. This video will talk about the Short, Warwick and Edinburgh Questionnaire and the Recovery Stay Well Plan. The first section, the Short, Warwick and Edinburgh Questionnaire, SWEMWBS, is valuable for monitoring well-being both nationally and locally. Whilst it is not designed as a clinical tool, it does seem to be sensitive to changes in mental well-being at the individual level. SWEMWBS is available for this purpose on NHS Direct and other public access databases, where scores are calculated to offer clinical advice. It consists of 7 questions, which should be filled out and answered by the patient themselves. There is a link to print-out version in the EMIS template. It can be given to the patient to fill out whilst waiting to be seen, or it can be completed together in the consultation. It is important to recognise that the scores need to be changed from 70 to 35, which is currently a preset feature in EMIS Web. The next section, Recovery and Stay Well Plan. The Recovery and Stay Well Plan provides a framework to assist GPs in working with patients with mental illness to review their care and promote recovery in a community setting. This page of the template includes 4 free text boxes to enable GPs to document discussion with the patient on 4 key questions. These boxes are signs of becoming unwell, anticipatory care plan, goals and priorities, and health action plan. Questions you may wish to ask in each section include the following. Under signs of becoming unwell, this is inquiring how we would have known that the patient is ill again. For example, how would you know you were becoming unwell again? Can you recall the last time you were unwell? How were you feeling then? For the anticipatory care plan for when unwell, consider what has previously helped you to recover. Would you need medication, psychological therapy, support, hospital admission? Under goals and priorities, we are trying to find out what feeling better would look like for them. How would you know you were feeling better or recovering? What would you like to be different about your life? What are your ambitions for the next year? This is a general and more of a psychological inquiry, but then needs to be broken down into details of a health action plan. Ideally, this should include a number of actions that the patient agrees to undertake within the next year. Discussion around this may include: how could we make this recovery plan achievable for you? What would be a realistic target for this year? What actions are you going to take? How can we support you with these? In completing this, reference should be made to the patient's SWEMWBS questionnaire results, which may indicate areas to develop as part of their recovery. Reference may also be made to the physical and social data collected on pages 1 and 3, which may also indicate areas of concern such as obesity, housing problems, and lifestyle factors. Try and make goals specific and measurable, but also attainable for the patient.